Welcome to the open enrollment video. My name is Julie Gillum from the Butler Health Plan. Open enrollment occurs October 22nd through November 22nd. Today we're going to discuss what open enrollment is, healthcare reform and eligibility of dependent children, re-enrollment, plan changes for 2011, and reminders. Open enrollment is the only time you can enroll in the medical or dental plan without a qualifying event. A qualifying event is caused due to loss of medical or dental coverage, due to divorce, death, spouse's coverage ends with employer, COBRA benefits are exhausted, you get married, adopt a child, or have a qualified medical child support order. You have 31 days to enroll your family member within the event. If you have a newborn, there's a special provision and you have 60 days to enroll your dependent. Healthcare reform now allows children aged 19 to 26 to enroll in the medical plan. This only affects the medical plan, not the dental plan. Dependent children aged 19 to 26 are now eligible to enroll in the medical plan. The employee must be actively enrolled in the plan. Dependents can have access to other insurance. They may be married. They're not required to live at the same residence as the parent, and they're not required to be a full-time student. Healthcare reform does not affect the dental plan. Eligibility requirements remain the same. Children are eligible up to age 19. After age 19, the child must be a full-time student. Dependent cannot be married, and the dependent may have access to other coverage. This year, everyone needs to re-enroll in the plan. You may enroll electronically. The information you'll need for online enrollment will be birth dates of your spouse and dependents, social security number, and you will also receive an open enrollment packet from your Human Resource Department, and how to enroll online information will be available on the Butler Health Plan website. Please note, if you're waiving medical or dental coverage for the first time, enrolling for the first time, or adding a dependent child, you must complete a Butler Health Plan enrollment change form and return to Paula Losi in the Human Resource Department and provide required documentation. If you're adding a spouse, the Butler Health Plan requires employees to join their employer's group medical plan at least on a single basis. This is not a requirement in the dental plan. If your spouse is not enrolled in his employer-sponsored medical plan, you must complete a coordination of benefits waiver in order to be waived from this requirement. You must also provide a marriage certificate and any financial information on your tax return, and return this form to Paula Losi. Here are the plan change highlights starting January 1, 2011 for the Choice Plan. You'll be receiving more information from your Human Resource Department. Preventative care is now covered at 100%. This includes your annual physical, well baby care, and preventive tests. Nutrition counseling has been added, 3 per year, $20 copay for additional diagnoses other than diabetes. Your in-network primary care copay remains the same at $20. Your specialist copay is new, and that is $35. Urgent care has increased from $35 to $40, and an emergency room visit is $150. Your deductible and coinsurance for in-network has not changed. Your out-of-pocket has increased $1,000 for an individual to $2,000, $4,000 for an employee plus one, and $6,000 for a family plan. Your out-of-network benefit, there's no change in deductible or coinsurance, but your out-of-pocket increased $4,500 individual, $9,000 employee plus one, $13,500 for a family plan. Prescription copays remain the same for a generic $10, 2.5 times that for mail order, a 90-day supply. Preferred brand increased to $30 for a 30-day supply, $75 for a 90-day supply. And non-preferred increased $50 for a 30-day supply, $125 for a 90-day supply. Your provider will now have 12 months to bill the plan in order to get paid, and that has decreased from 15 months. So, if you fell asleep during this presentation, now it's time to remember the important points. Remember, everyone must re-enroll. Open enrollment runs from October 22nd through November 22nd. No changes will be accepted after November 22nd. Great Oaks only offers the choice plan. If you're coming into the plan for the first time or adding a dependent, you must provide the required documentation. Divorce decree identifying medical coverage for children if applicable, adoption, marriage certificate, birth certificate, or your most recent tax return with your financial information blocked out, or any legal documentation of guardianship like a qualified medical child support order, and then a spouse coordination of benefits form in order to waive your spouse from the requirement to carry their group-sponsored plan. Thank you for viewing the open enrollment video. More information will come from your Human Resource Department during the month of October.